Walking on bone is how some people describe foot pain after major weight loss. It can appear while using Ozempic, made with Semaglutide, or Mounjaro, made with Tirzepatide. Your foot may feel less cushioned, but the drug may not be directly damaging it. Pain location is the first clue separating cushioning problems from nerve pressure, arch strain, and bone injury. The bottom of the foot has fat pads that absorb impact. They sit under the heel and the joints behind the toes. Changes can alter shoe fit and pressure. An old shoe may load a smaller area each step. These pads are not loose body fat under the skin. They contain fat chambers held together by fibers. Their job is to spread force and protect bone. Pain can develop when this tissue becomes thinner, shifts position, or loses elasticity. Weight loss changes more than the number on the scale. Feet may become narrower, arches may move differently, and old shoes may fit poorly. People often exercise more as weight falls. Those changes can expose a problem previously hidden by inactivity. The phrase Ozempic feet can therefore mislead. It is not an official diagnosis, and drug labels do not list foot pad loss as a reaction. These drugs are not known to directly thin foot cushioning. The real issue is pain during weight loss, changed activity, or altered pressure. Cushioning pain usually feels deep, bruised, or tender in the center of the heel. Hard floors and barefoot walking often make it worse. The pain may continue during standing, rather than appearing only during the first few morning steps. That pattern differs from plantar fasciitis, irritation of the strong band supporting the arch. Plantar fasciitis often hurts near the inner heel. It is usually worst with the first steps after sleep or after sitting for a long time. Pain under the forefoot creates another pattern. You may feel as though a pebble is trapped inside the shoe. Thin soles, high heels, or loose shoes may increase pressure during walking where support has changed. The timing can confuse people. Pain may begin after a dose increase, yet the dose may not be the direct cause. Stronger appetite suppression can speed weight loss and reduce food intake. Weakness can follow when protein and calories fall too low. More activity can also create pain. A person loses weight, feels better, and suddenly doubles daily steps. Fitness may improve faster than foot tolerance at first. Tendons, bones, and stabilizing muscles still need time to adapt. Weight loss can therefore help one foot problem while exposing another. Less body weight may reduce pressure caused by obesity. At the same time, loose shoes, harder exercise, or less soft tissue protection may create a new source of pain. Most new heel pain during treatment is not proof that the medicine dissolved the foot pad. The drug may get blamed, while loose shoes, plantar fasciitis, or an exercise injury goes untreated. Stopping treatment may allow weight regain without correcting the mechanical problem. A stress fracture is one diagnosis that should not be missed. It is a small crack caused when repeated stress outpaces bone repair. Pain becomes focused, worsens with walking, and may continue at rest. Swelling or a sudden activity increase raises concern. Nerve pressure creates a different warning. Burning, tingling, electric pain, or numbness is not typical cushioning pain. Major or rapid weight loss can rarely remove padding around the nerve near the outside of the knee. Weakness may follow when lifting the foot. Foot drop means the toes drag, or the front of the foot slaps the floor. It needs prompt assessment, not just softer shoes. Crossing the legs for long periods can add pressure to the same vulnerable nerve. Diabetes adds another layer because reduced sensation can hide injury. A blister, callus, crack, or hot swollen area may not hurt. Check both feet daily when sensation is reduced. An open wound, spreading redness, drainage, or black skin requires urgent care. Start with location. Central heel tenderness points more toward the heel pad. Inner heel pain suggests the plantar fascia, the strong band under the arch. Pain beneath one toe joint suggests concentrated forefoot pressure, while pain on the top or side raises different concerns. Next, test the pattern without repeatedly provoking severe pain. First step morning pain favors plantar fasciitis, while pain on hard floors favors cushioning loss. Burning or numbness favors a nerve problem. Increasing pain during repeated walking raises concern for overuse or stress injury. A dose increase may seem like the obvious explanation because the dates line up. Yet the same timing can hide loose shoes, new exercise, a nerve problem, or bone injury. The calendar cannot identify which structure is hurting. The pain map matters more than the medication date. Location, sensation, timing, and the effect on walking guide next steps. Inspect your shoes. Replace pairs that became loose or have flattened cushioning, and choose stable support under the painful area. More cushioning is not always better. A soft shoe can feel unstable and shift pressure elsewhere. Support should match the painful location. A foot specialist can determine whether a heel cup, arch support, or small cushion behind the toe joints fits the problem. Stop walking barefoot on hard floors while the area is painful. Reduce running, jumping, and long standing temporarily. Replace them with lower impact activity that does not reproduce the pain. Return gradually instead of alternating complete rest with sudden heavy exercise. Calf tightness can increase strain through the heel and arch. Gentle calf and arch stretching may help when the pattern fits plantar fasciitis. Stretching is not treatment for a suspected fracture, open wound, severe swelling, or new weakness. Mechanical support is only part of recovery. Extremely low intake can leave you short of protein, calcium, vitamin D, and energy needed for tissue repair. That does not prove deficiency caused the pain. It means persistent undereating deserves correction during rapid weight loss. Do not chase faster loss just because the scale is dropping. A dose that suppresses eating until strength, hydration, and nutrition suffer may be too aggressive. The goal is fat loss while preserving muscle, activity, and recovery. Pain that persists, limits walking, or becomes sharply focused needs examination. Ultrasound can assess the plantar fascia and heel pad. An X-ray may miss an early stress fracture. Magnetic resonance imaging, a detailed scan, may be needed when suspicion remains high. Dose decisions depend on the full picture. Mild pain from shoe fit or pressure may not require stopping treatment. Rapid loss, marked weakness, repeated falls, severe undereating, or nerve symptoms may justify slower dose increases and reassessment. Consider two people with the same heel pain. One has central tenderness after walking barefoot in loose shoes. The other has pinpoint pain and swelling after doubling running distance. The first may need cushioning, while the second needs evaluation for bone injury. Seek urgent care for an open sore, spreading redness, or a hot, swollen foot. Inability to bear weight, new foot drop, or severe pain after injury also needs urgent assessment. Diabetes, poor circulation, or reduced sensation justify earlier examination. Foot pain during Ozempic or Mounjaro treatment is real, but lost cushioning is only one possibility. Map the pain, check shoe fit, review activity changes, and watch for nerve or bone warnings. Successful weight loss should make movement easier, not more painful. Medicine simplified. That's what this channel does. If you want more, hit subscribe. This is not medical advice. Consult your doctor.